Hello, this is Luis. Welcome to the HDTV updates from the ESC 2022. Today we bring you the Day 4 updates of ESC 2022. McMurray, in an intriguing session on SGLT2 inhibitors across the spectrum of heart failure, suggested that ACE inhibitors or ARBs, neprilysin inhibitors, beta blockers, MRAs, and SGLT2 inhibitors are the 5 alive or fantastic and or Fab4 life-saving therapies for HFrEF. According to the DELIVER and SOLOIST WHF trials, dapagliflozin and sotagliflozin are effective in improving HF outcomes respectively. Berwanger presented the findings of the PARADISE-MI trial's win ratio analysis, which indicated that sacubitril and valsartan were superior than ramipril in high-risk MI survivors. For trials with composite outcomes, where the clinical relevance of different types of events is ranked, win ratio analysis can be a valuable adjunct to conventional time-to-first event analysis. Kai, who conducted a session titled How to Achieve Blood Pressure Targets in Clinical Practice, underlined that antihypertensive medication classes acting synergistically might assist to significantly improve BP management. He also proposed that the appropriate antihypertensive therapeutic strategy be determined by an individual's cardiovascular risk profile, as well as blood pressure levels and drug acceptability. Valgimigli presented the outcomes of the 15-month MASTER DAPT trial, which found that perceived ischemia risk or prior ischemic events influence therapy intensity, either DAPT versus SAPT or SAPT versus no APT, but no bleeding risk or prior bleeding events. Bangalore highlighted the findings of the ISCHEMIA-CKD Extend study, which revealed high rates of mortality, around 40%, and CV death around 30% in stable CAD and CKD patients after 5 years. At a median of 5 years follow-up, an initial invasive and conservative strategy resulted in similar survival. Bono concluded in a session on multivalvular disease in patients with severe aortic stenosis that moderate or severe mitral regurgitation in TAVR patients is linked with a greater early but not late mortality rate. At 1-year follow-up, 55% of patients with moderate or severe mitral regurgitation at baseline had improved mitral regurgitation. O'Meara presented a session on the management challenge of atrial fibrillation in HFrEF and HFpEF, and underlined that patients with AF and HF represent a high-risk population that may substantially benefit from rhythm-controlled treatment. Catheter ablation for AF is associated with improved quality of life, exercise capacity and LV function, and reduced AF burden, hospitalization for HF, and mortality in patients with AF and HF. This concludes our coverage of the HDTV updates for Day 4 of the ESC 2022. We'll meet again next year at ESC 2023. Till then, take care.